and welcome to this special broadcast hashtag tracking COVID-19. I'm Munmun Bhattacharya, and over the next 30 minutes, we'll take you through the main national and global developments in COVID-19 with ground reports and international news coverage of the spread of the virus. Let's get started with the headlines. Prime Minister Narendra Modi holds video conference with chief ministers of all states. Most states request PM Modi to extend the nationwide lockdown. Government says it is considering the request. Maharashtra extends lockdown till the 30th of April. Active cases across India rise to 6,634 with 242 fatalities and 652 people discharged. Health Ministry says India's response to COVID-19 has been proactive. 586 COVID-19 dedicated hospitals and more than 1 lakh isolation beds set up across the country. Home Ministry requests states and UTs to provide police security to doctors and medical staff if needed. Security to be provided in hospitals and quarantine facilities where they are working. Government is in the process of releasing 12 million metric tons of food grains in 3 months under Pradhan Mantri Garib Kalyan Ann Yojana. Free ration already reaches 2 crore beneficiaries. And the World Health Organization warns of the possibility of deadly resurgence of coronavirus if lockdown restrictions are lifted too quickly. Global death toll goes past the 1 lakh mark with more than 17 lakh cases reported worldwide. And here's India at a glance, the big picture on COVID-19 in terms of numbers. In India, active cases are 6,634, cured and discharged are 652, deaths are 242 and 1 person has migrated. So the overall number is a little above the 7,000 mark. That's India at a glance. Meanwhile, Prime Minister Narendra Modi on Saturday held a meeting with chief ministers of states via video conference to discuss ways to deal with coronavirus pandemic. In the meeting, several chief ministers made a request to extend the ongoing nationwide lockdown by 2 more weeks beyond the 14th of April. The ongoing 21-day nationwide lockdown to contain the COVID-19 crisis announced by PM on the 24th of March is scheduled to end on the 14th of April. Meanwhile, ICMR has clarified on who can consume hydroxychloroquine, the drug that is related to COVID-19. Listen in.
हमको इसका उपयोग जो है वो सिर्फ डॉक्टर्स में करना है ये स्टडी के अंतर्गत या जो लैब कंफर्म्ड केसेस हैं उनके जो कॉन्टैक्ट्स हैं उनमें ही करना है। ये पैनिक जो फैल चुका है इसमें अक्सर ये दिखाई देता है कि हम थोड़ा रीजनिंग जो होता है हमारी सोच जो होती है थोड़ी इमोशनल बन जाती है। हम ये सोचते हैं कि मैं भी खा लूँ तो अच्छा होगा। ये टालना हमारे लिए बहुत ज़रूरी है क्योंकि जब तक हमारे पास उतना एविडेंस नहीं आएगा हम आम लोगों को ये दवा लेने के लिए हम न बोलेंगे न उनको ये लेना उनके सेहत के लिए अच्छा होगा क्योंकि कोई भी दवा जो रहती है उसके साइड इफेक्ट होते हैं वो डॉक्टर को मालूम होते हैं.
And the government's official fact-checking entity has debunked media reports which claimed that the Ministry of Railways has issued protocols regarding passenger travel post-lockdown period. The PIB fact-check team tweeted that such claims are speculative and misleading. No such protocols have been issued by the government. And here's the clarification that's come in. Meanwhile, PIB also dismissed media reports of shortage of hydroxychloroquine for Mumbai doctors dealing with COVID-19. PIB fact-check team termed the report as fake. That's PIB fact check kicking in with these clarifications that have been issued. And we'll also now tell you the overall situation in the country as far as COVID-19 response and preparedness is concerned. Remember, India has been saying that it began with what was over-preparedness, taking steps even before the first case was reported. And here you can see fishing, marine, aquaculture industry have been exempted from the lockdown. You can see that India battling COVID-19. Fishing, aquaculture and all these industries have been exempted. Their operations have to follow social distancing and hygiene norms. So this is very important that the exemption is conditional in nature. District authorities have to ensure strict enforcement of the same. Firm heads also need to ensure that these guidelines are followed. Centre has told states to provide police security to doctors and medical staff. So this is extremely important. If required, that police security needs to be provided. Centre has told states to provide security at screening and quarantine centres as well, where these medical staff members are deployed. Moreover, availability of essential commodities is being monitored at all levels. This is a continuing exercise. NCC and NSS cadets, civil defence volunteers have come forward in order to help people in general. Besides that, the Central Armed Police forces have set up quarantine centres. Awareness campaigns have also been undertaken by them so that the word reaches to the last man. Besides that, the CAPF are providing a dry ration and packed food to stranded workers. So CAPF doing all it can in these testing times. Well over 1,70,000 samples have been tested in India so far, beginning with one laboratory that we had sometime in January. 146 public sector labs and 66 private labs are there in India as of now. Besides that, India followed a graded response action plan. So our response has been graded. With time, we have upped the ante, so to say, against COVID-19. 586 dedicated COVID hospitals are there in India as of now. And 1 lakh isolation beds, and in that there are 11,500 ICU beds as well that are available in the country. The Ayush Ministry has said that incorporating guidelines and district contingency plans, what the Ayush Ministry has in terms of guidelines for immunity boosting for people. And here's a projection that without lockdown and containment measures, there would have been 8.2 lakh cases by the 15th of April. That underlines the effectiveness of lockdown and containment measures. Had there been containment measures but no lockdown, the situation would have been that there would have been 1.2 lakh cases by the 15th of April. This is part of the same study of which has made projections. Over 11% increase in sowing area in Kharif season. So there is good news coming in as far as the agriculture sector is concerned. Let's move on now to the railways sector, and after this you'll take a look at how the railways is faring. Over 1 million free hot cooked meals have been distributed by railways in different parts of the country to the needy. Besides that, rapid antibody test kits will be available soon. The orders have been placed and soon they would be available. Rapid kits take time to test positive. We'll tell you more on how they operate. Next, positive test confirms the presence of antibodies. So the test actually confirms the presence of antibodies, and kits can help confirm trend of virus spread in hotspots. So this is why the usage of these kits are important. As far as health workers are concerned, if they test positive in a rapid test and negative in a PCR test, then that confirms immunity, and thus they can continue doing their work. Rapid antibody tests are just first generation tests, will refine with time. So with time, the refinement will set in, and there is no shortage of HCQ tablets in India. As of now, this is a repeated assertion being made by the government of India. India has in fact thrice the number of HCQ tablets that are required for domestic use. Besides that, let's take a look at the number of tablets with the private sector, 2.65 crore at this point in time. And there are more than the private sector is likely to get. Additional 2 crore tablets are to be provided to private sector at the field level. Having said that, there's more coming in terms of information. HCQ can be consumed only by doctors and contacts of positive cases. We heard earlier the ICMR scientists say that there are a lot of precautions that need to be followed here. Also, this is available on medical prescription. This can't be taken as an over-the-counter drug. Moving on now, Karnataka Chief Minister Yediyurappa has said that his government is receiving suggestions for extending the lockdown for the next 15 days. And Good Samaritans are also coming forward in the state. Social distancing and stay home does not prevent anyone from helping the deprived in this hour of crisis. A Bangalore-based cartoonist has come up with a unique initiative to demonstrate this. He is making caricatures of people who wish to help but can't step out of their homes. Our correspondent Aisha Khanam reports.
COVID-19 pandemic has brought the world down to its knees, but people refuse to kneel down. and there is a united fight against this dreaded virus. On one hand, the government is making all effort to fight this dreaded virus. At other hand, there are several volunteers and several good Samaritans who are coming in their own way and contributing their might to fight this dreaded disease. Now, when you stay home, it does not mean you cannot help people from home. There is a very interesting idea that has come from stay home. I have with me a good Samaritan from Bangalore, Rashid Kappan, who is a journalist and also a cartoonist. Rashid Kappan has come up with very interesting and novel idea, which in he is working from home, he is helping from home, and he is also inspiring people and motivating people to contribute their might to help the people and the needy in their neighborhood. So let's find out what Rashid is doing and what it means to say that he is making cartoons. The cartoons are very interesting cartoons that he is making. Rashid, a very interesting idea, cartoons. What exactly is this and how did you come up with this idea?
Cartoons is a project where I draw cartoons of my friends sitting at home, and they pay me, they are supposed to pay 500 rupees as a minimum charge for it. But in my experience of the last 15 days, I've drawn some 32 cartoons. The entire idea is to finally draw 150 cartoons. But in 15 days, I've raised about 45,000 rupees because people are paying much more than 500 rupees. So they give that money to some daily wager or a maid or anybody really in need of this lockdown period when their livelihood issues are at stake. So I've been getting a lot of requests from friends, their friends, and the circle is growing. And also a few other cartoonists, one or two have come forward to help me out do some 10-20 cartoons.
Okay, what is the cartoon you are making today? We see one, you are working at one cartoon. What is this cartoon?
This is Tripti Rao. She's a former Mrs. India. So like this, people send me their photographs or I take their pictures from the Facebook. Of course, resemblance issues sometimes crop up, but anyway, it's a caricature. So I have to do it my way. And the response has been extremely inspiring to me. A lot of people want this to spread further using art for a cause.
You said it's a last mile effort.
Yeah, this is the idea. Whole idea is that a lot of people give to a NGO or an organization. This idea was like you give it to a person known to you in your own circle. So it could be a maid who's known to you for years, or a Paura Karmika, a garbage collector who comes to your house. So you know them. So there is a different feel to when you accomplish this last mile connect to the person who is needy.
Okay. So that is an interesting way of contributing to help the needy, and this is being done by staying at home. And also those who want to contribute are also at home. They are not at all in contact with Rashid Kappan. He just sees their picture and makes their cartoon, and they give their contribution to help the needy around them. So this is a unique idea, and this is the spirit that is keeping up the fight against Corona alive in Bangalore. Aisha Khanam, DD India, Bangalore.
Preemptive action has been taken by West Bengal government to identify COVID-19 hotspots in the state as 6 more positive cases were identified in the state. Our correspondent Momita Biswas files this report.
Currently, we are at Gadiya Hut. You can see the lockdown is completely imposed here. Yesterday, there was a high-level meeting with the Chief Secretary of West Bengal and the officials of Bengal, where 10 hotspots has been identified, where there will be the lockdown will be for more than 14 days. The lockdown, the level of lockdown will be highly intensified in those areas. Proper sanitization will be done in those areas. Test will be done in those areas where the hotspot will be identified. People will be not allowed to go inside or come inside or come outside in those areas. Though the government, the state government is saying that the people should not be panic in those areas. Door-to-door services will be given. Essential commodities will be provided by the state government in those areas. If we talk about the total cases of COVID-19, currently in the state there are 89 positive cases, along with the death total rises to 5. If we talk about the whole scenario, yes, the state government along with the central government, under the guidelines of the central government, the state government is taking all the precautionary steps to combat COVID-19. This is Momita Biswas with camera person Madhuri Rao, DD India, Kolkata.
So that was the news from India, and shifting gears, here's how some countries are faring on the COVID-19 meter. Well, a look now at the international news coverage of COVID-19 in Media Scan. In Media Scan, let's take a look at how COVID-19 is being covered by international dailies in terms of news and analysis. Let's open the New York Times. This is the online edition, and this reports that Trump has said that countries must accept deportees or lose visas. Go further into it, and you find out that the Trump administration has said that it will be issuing visa sanctions against countries that refuse to accept people the United States aims to deport, and that's the latest restrictive border measure implemented amid the coronavirus pandemic. Let's now shift focus to the Washington Post, and here on the front page you see that an attack plan has emerged, but it is not from the White House. So who has proposed this attack plan, and what is the position of the White House on it? When you go further into the story, you come to know that it is a collection of governors, former government officials, disease specialists and non-profits who are pursuing a strategy that relies on the 3 pillars of disease control. What are those 3 pillars? The first being testing, ramping up testing. The second being contact tracing on a scale that has never been attempted before. And the third being that you focus restrictions more narrowly on the infected and their contacts so that the rest of the society doesn't have to stay in permanent lockdown. But there is really no evidence so far that the White House will pursue such a strategy or not. Let's now shift focus to the Wall Street Journal, and here you see these graphic images, and this report says, with America at home, the streaming war is Hollywood's ultimate test. Families looking for a distraction are plugging into home entertainment more than ever before, but producing new shows to satisfy these viewers is getting more difficult the longer the coronavirus pandemic lingers. So this story is from the perspective of the home entertainment industry. Let's shift focus now to The Guardian, and the UK edition reports on the birth of a pandemic. It's a very interesting story. It says that inside the first weeks of the coronavirus outbreak in Wuhan, so it is going into the first few weeks after the outbreak was reported in Wuhan, and it says that by the time officials revealed the infectiousness of the virus, hospitals in Wuhan were already overwhelmed and the numbers increased after the announcement. So things felt out of control. Another interesting story in The Guardian is about the stories of UK's coronavirus victims. And these images that you see are those victims of coronavirus in the United Kingdom. The question arises, who are the victims? Well, these victims are doctors, counselors, a D-Day veteran among them, a diplomat, a comedian, and an academic. So that's about the international news coverage as far as news dailies are concerned on COVID-19. Well, a look now at international news stories. The Director General of the World Health Organization, Tedros Adhanom, has said that there is a lesson to learn from the widespread pandemic for every country, even for those who believed they have advanced systems. Noting that the hardest hit European countries are happy to see slowdown in COVID-19 spread in the past week, he warned that the virus is spreading fast in African countries and has already imposed pressure on local health systems there. He said that from this pandemic, we have to try to learn, focus on learning what the gaps are. This is not a message only for the developing world, he said, but this is a message even for the developed countries. Istanbul, Ankara and other major Turkish cities have been locked down for 2 days to combat the spread of coronavirus. As the country's death toll from the pandemic rose above 1,000 on Saturday, the restrictions were imposed in 31 provinces across the country and scaled up existing curbs under which people under the age of 20 and over 65 have been told to stay at home. Turkey has also halted all international flights, restricted domestic travel, closed schools, bars and cafes and suspended mass spreads. The Wuhan city, worst hit by the COVID-19 in central China's Hubei province, is implementing strict control measures on its public transport system as the city lifted its outbound travel restrictions on the 8th of April, ending a 76-day-long lockdown. At present, 2 major ferry lines have reopened. The city has a total of 8 ferry lines. Passengers need to provide their health codes and have their body temperatures taken at the entrance of the wharf. They are reminded to keep social distancing when they buy tickets. Every passenger needs to scan QR codes twice before boarding. Besides the ferry service, other means of public transportation like buses and subways are also implementing strict prevention and control measures like scanning codes and frequent disinfection of public facilities and public areas. That's the situation in Wuhan, where it all began. Chinese Health Authority today said it received reports of 46 new confirmed COVID-19 cases on the Chinese mainland on Friday, of which 42 were imported. 3 new domestic cases were reported in Guangdong province and 1 in Heilongjiang province, the National Health Commission of China said. US President Donald Trump said on Friday that he will soon be announcing a second coronavirus task force, creating a council to focus on reopening the country after the worst of the COVID-19 pandemic passes. The council is expected to include Treasury Secretary Steven Mnuchin and White House Senior Economic Advisor Larry Kudlow, among others, a senior administration official said earlier in the week. Trump said on Friday that state governors will also serve on the council. And Ireland on Friday extended its stay-at-home coronavirus restrictions until the 5th of May as Prime Minister Leo Varadkar said the curbs had significantly slowed the spread of the outbreak, but more work was required to end it. Ireland has shut bars, restaurants and non-essential retail, and Varadkar told people late last month not to travel more than 2 kilometers from their homes or visit friends and family until this Sunday, which is the 12th of April. Everyone must wear a face cover in these testing times. Here's how the globe has adopted masks. So let's make our own masks, join the Mask India movement. And we now leave you with the reason for hope during lockdown, because hope is not locked down. Stay safe, stay healthy, keep washing your hands, keep using sanitizers, keep wearing face covers. That's it. Thanks for watching.